I'm sure a lot of folks watching have that little voice inside their head, like I do, that little voice that says, I feel okay, but maybe is there something wrong with me with my health that I don't know about?
Yeah.
Should I go in for a checkup? Am I certain that I'm healthy? That little voice chimes up quite a bit. Well, how about answering that voice by getting an actual test? How about taking a detailed look inside your body down the street at Preventative Diagnostics?
Absolutely. Dr. John Pierce, he's a medical director at Preventative Diagnostic Center, and that's what he does. He takes a peek in all of our bodies, but in a very quick and easy way. How are you, sir? Good to see you.
I'm amazing. How are the two of you?
Doing so well. You know, occasionally you'll hear like somebody with a terrible illness, but hey, we caught it early, stage 1. Oh, thank goodness. That's great. Great trajectory. Often, like, they catch that stuff by accident. They catch it like, oh, I sprained my knee, and then they looked and they saw a thing. This is a chance to see things before you're starting to see the symptoms. Tell us about what it is that you have there at Preventative Diagnostic Center and helping people keep their health up.
Absolutely. So, you kind of hit a great point because those incidental findings generally can yield better results. So we know, and God forbid, if somebody gets cancer, the earlier that we can diagnose it, that early prognosis or diagnosis leads to a much healthier and better outcome or prognosis. So we have the Siemens Somatom Go All Pro CT scanner, which is really unique. It's the only one outside of like Palo Alto here on the West Coast. It does measure the individual before they actually get the CT scan to determine their density and doses the radiation per each individual. So we get the lowest exposure to radiation with the greatest imaging results. And with those imaging results, we can detect abnormalities down to about the size of a grain of rice. That being said, we can catch abnormalities such as plaques in the coronary arteries, to sense if they have a high amount of those, and a high risk for heart disease. We can send them to the cardiologist for early testing and intervention potentially. We can detect cancers. We can detect enlargement of the blood vessels, like in the aorta. You can have a dilatation of the aorta, which can lead to an aneurysm, and that needs to be addressed. We look at, sometimes we find something as simple as kidney stones, and people don't know they have them, and let them know that they might be passing something. So
warn them, batten down the hatches.
I heard they're painful.
Oh, they're not.
Yeah, you don't want one.
Yeah, certainly. Hey, speaking of the Siemens scanner that you use, by the way, I think when I think of getting a body scan, and laying down for something, I get a little intimidated. I think, oh my gosh, am I going to be claustrophobic? Am I going to be stuck inside like a small cell for a long time? In fact, your scanner is a totally different experience. It's quick, it's easy.
Yeah, you've actually experienced it, JJ. So there's no big tunnel to be in. It's just kind of like a donut that you go through. Your head is not enclosed in anything for any period of time. And the scans usually take about 20 to 30 seconds. So very quick and easy. We haven't had anybody run out because of claustrophobia.
Which is good. That's nice. Once you do the scan, because it's so important that people get this. I think there's, especially over the past couple of years, COVID, people getting a little bit nervous walking into a doctor's office. They might not be getting that checkup. They might not be getting the diagnostics that they should be getting to make sure that they're in good health. They do your scan. What ends up happening with that scan?
Well, the scan gets sent right over to our radiologist, and he reads it, and we get a full read and report from him. And then generally, if the person is in good health, we just send that result on to them. There's really not much to do, but if there's something that we find that needs some follow-up in relatively short order, and they need to pay attention to it a little quicker, then I'll personally give them a call and discuss the results with them. And then we'll send that result on to them. And generally, they'll follow up with their primary care doctor or a specialist in the particular area that the area of concern is.
Yeah, and a lot of folks come in with their partner, with their spouse, with a good friend, with a family member. And in fact, your special offer today is for 2 people, because you see this happen so often, and it's a great way of kind of giving each other a little encouragement to get in there and get these results.
Yeah, human beings are kind of community-based, so it's nice to have a friend or a partner go with you. So what we're doing is we're offering 2 heart scans with calcium scoring to to the individuals for a total of $125. Generally, we charge $5.99 per scan, but both scans will be for $125.
Phenomenal. Great chance to get in and get a little look underneath the hood. Great to talk to you, my friend. Thanks for joining us.
Thank you.
Thank you.
Our Preventative Diagnostic Centers. You get a heart scan and calcium score, $125 for 2 people. That's 2 scans. Usually it's $5.99 for 1. You want to learn more? Go to
Wow.
pdcenterlv.com or call the number you see on your screen.